So, why should you become relationship health and IMATRA informed as a therapist or a coach or as a frontline practitioner working with children and families? Now, the answer to that question ought to be fairly straightforward, shouldn't it? Surely relationship health is something we've been talking about. But it turns out that actually relationship health is an idea that we've not been talking about, not in many forms of therapy, not in many forms of coaching, not in many forms of child and adult wellbeing practice. That's quite a shocking idea, really, to discover that though lots of people have been talking about relationships for sure, this term relationship health is not something that we've been using. In this video, I want to make a case for the whys of becoming informed, particularly about relationship health and specifically about an IMATRA approach. And then I want to talk about the hows of doing it. Now, the first why is that I think that this is a term that we haven't been using, but that can potentially really help join up a whole array of really good practice that's been progressed by in a wide range of traditions, but which hasn't yet had a shared identity. And why is that important is that I have seen over years and years of practice is that families experience the issue of having a difficulty going to see one practitioner who use one set of language, going to see another practitioner who use another completely different set of language, going to see a third practitioner and it's a third set of language yet again. What I think the term relationship health provides us as a possibility is this idea of an umbrella and a foundation, because when we actually look back at the science that each of these people are using from their different forms of practice, they're often drawing on a very similar research base. They're just giving a little different angle on it. I call it like the blind men and the elephant. We're looking at the issue of the challenges that we see, but we're picking out slightly different ideas and issues and we're focusing on different things. The problem for the family that's trying to navigate that experience is it feels as if everyone's talking about completely different things. The term relationship health can, I think, enable people to relax if we're saying we're kind of talking about similar things. We might be using slightly different language, but yes, the terms that this person may be using, I would also see them in fact in a very similar way. An IMATRA approach is something that I've developed. I went back to the science because I was feeling very confused as a practitioner. And I thought, well, let's try and bring this all together. And I've developed something called the IMATRA framework to crystallize out the ideas that I found in my own practice. I referred to again and again and again, influenced by a wide range of practitioners indeed, but then put into a format that's easier for families to understand. So the why, from my perspective, having seen many families on waitlists who feel like they've been round and round and still don't really understand what practitioners are talking about. The why is, if we want to be more effective as a community of practitioners, we need to develop some sort of shared messaging that's more impactful. And my suggestion is that relationship health is a term that can really support that thinking. So why is about getting some shared messaging. I've increasingly felt that professionals need to grasp the responsibility that we have to get our act together, to communicate our shared intentions and beliefs about the direction of travel. That doesn't mean to say that we've got to collapse all of our differences down into one kind of totally uniform message, but we do need to figure out what's our direction of travel, what do we need to collectively focus on, and what are the collective messages that we need to communicate to the wider community, because right now the messages are, I think, rather muddled. So, final way, I actually think it feels a whole lot better when you're working as a sole practitioner and the things that you're trying to share are feeling unsupported and you're the only person emphasizing key details. You're not part of a joined-up network. That can feel very exhausting, very demanding work. When you feel you're part of a wider community and those messages are more joined up, then it can feel a whole lot better. You can feel like you're part of being impactful at a community level in a way that feels much more satisfactory. So there's 3 whys. Now the how is, I think, in order to be able to have some shared language, taking some time to just learn the IMATRA framework would be one thing that I would suggest to you can be helpful in terms of giving you some understanding of some core science, much of which I think will be familiar to you, with certain elements that will be a bit distinctive. But again, by getting that language, you get this ability to talk with others and to empower your families and clients more effectively with the same language. The second, how do you do it, is by learning how to get this language and learning how to use the resources that are available. You've got tools that you can use to complement your own approaches, to develop understanding, so that it doesn't always fall back to you to communicate all the language and develop it yourself. So there are posters and online tools that you can use to engage and empower your own community with the learning. Then finally, I would say practice and get support from other people who are using this language. All right, it's very, very easy to just learn it once and then you forget it. But actually, when we practice it, then it starts to become much more second nature in the way that we think about the problems that we're seeing, the way that we put together case formulations, the way that we identify the possible options in terms of a way forward, and the way that we advocate for community-wide change. So I want to encourage you to learn more, take some time. You can join up for the newsletter, you can get started immediately, or you can access more training through your organisation. We look forward to hearing from you and hearing your questions.